Let's have a look back here and find your old scar. It's very well hidden, isn't it? There she is. So it's just a really fine white line along the back of your head here, about a millimetre and a half wide. So you healed beautifully. A limiting factor for the next surgery is the elasticity in your scalp. So if I pulled here, it's impressive actually. Good. More than I expected. Headstands work. Bit firmer along these bony prominences. So we'll need you to massage.
That's always the tight area.
Yeah.
Over the bones.
Try to avoid the bony prominences.
You bonehead. And along the sides here, I need you to massage really firmly to loosen that up. The looser it is on surgery day, the more we can take, which means better result for you, but also better scarring and less of a headache for you post-op. My guess, we're looking at a ballpark of 2,000.
2,000?
Yeah.
How do we use them?
What are you looking to achieve? What's your priority?
A little bit more density at the front.
Mm-hmm.
The most important area is where you go from vertical to horizontal. So there's an area in here that needs thickening.
It's quite a good time to refer to a photograph that was taken with my mother at a wedding. You can see here at the front, there's a really nice placement of the grafts.
That's the bit I'm talking about. See how it's a little bit see-through there?
I'm wondering if it would be possible, as viewers look at the photograph, that left side, my right side, is perhaps a little less dense and there's some spaces in the middle.
Mm-hmm.
Can we maybe fill some of that up?
Of course.
How much coverage can we gain me at the back?
What's more important to you? Thickening up this or covering the back?
It's always both.
Just like all the other patients.
Of course I am. I would love to balance that first, thicken this second, and gain density third.
Okay.
We've established that a second procedure is possible.
Mm-hmm.
Some of our viewers may be wondering, well, why can't we just do more at the outset in the first procedure?
The primary reason is the safety of the follicles and getting them to live and survive and grow. So we know at our clinic, and we are one of the fastest clinics in the world, we can do up to 4,500 in a single session. Now, those follicles, so the whole procedure needs to be done in under 10 hours so that all of those follicles survive. If they're out of the body for longer than that, they start to die off. Jenny?
It's not a matter of how many we transplant, it's actually how many grow. And so that we will limit the procedure according to the capacity of our staff, and certainly, as Sarah knows, we're one of the fastest in the world.
The limitation for you was your skin elasticity. It's a combination of how much do you need and how much can we get because of your skin elasticity and also in that time frame.
You have to have a team that really takes care of your follicles from beginning to end and really plans your procedure.
Does that make sense?
Yes.
If you consider hair with no hair loss, so a full head of hair, for every square centimetre you've got 100 follicles coming out of the skin. Now if we tried to replicate that up here and make 100 incisions for every square centimetre, we end up doing too much damage to the blood vessels underneath. It cuts off the blood supply and no hair will grow and the skin will die and it's a disaster. So we know from studies that the safest we can achieve to get 100% growth there is 49 per square centimetre, which is what you've got, and it looks beautiful and natural. But now that we're more than 12 months down the track, that skin has healed, you've got your blood supply back, you can go back in and fill in the gaps and thicken you up so you're close to that 100 per square centimetre. But it's not safe to do it in the single session.
Okay. Because you're damaging too much of a concentrated part of the scalp.
Correct. And it just won't heal.
Okay.
So he's 16 from side to side, 16 centimetres.
Mm-hmm.
So I think we'd build up. Perhaps 800 through there, then put in another 200 into the further back in the forelock.
It's a big head.
I know.
Okay, make it 400.
Big noggin.
So
big brains.
So it's 1,200, 13, 14, and the balance in there.
Regarding the scar, it's been incredible, the healing process. I was absolutely thrilled. It was barely visible after 6 months.
Your skin was tight. we could easily get the 4200 knowing that we could close you and give you that beautiful scar. We wouldn't want to push it too far in a single session because that's when you end up with poor scarring. A limiting factor here is how much stretch you have in your skin.
Okay.
So how much skin and hair can we take out safely so that you can still be sewn together and have a tiny, tiny scar.
So
in our clinic, we only ever have one scar, so that when we're going back to you, for the second procedure, we will go above and below so the old scar comes out. So single scar only, please.
To get the best scars, you need the least tension on the stitches. So we always use a double layer closure. So you've got stitches underneath, which are doing most of the work, and then you've got your superficial stitches that you see. Now on top of that, we do something called a trichophytic closure. It's a technique that whereby when we bring the two edges together, the hairs will grow through the scar tissue to make it disappear.